Welcome back to the Stephen Knight Show. Our next guest is an award-winning dentist who joins us to discuss the importance of dental care. Please help me welcome Dr. Gabrielle Sapienza. Welcome to the show.
Well, Stephen, thank you so much for having me this evening. It's a pleasure.
I definitely appreciate you taking time out your busy schedule. I think one thing we don't talk about a lot is dental health and how important it is. But let's start off. What made you pursue this career field?
Oh, Stephen, that's a great question. And so I think a big thing is that for me, I grew up in the dental field.
Mhm.
Literally, I grew up in a dental office. Having parents that are both part of the dental field, the dental profession, my father being a dentist, and my mother is a hygienist.
Okay.
Um, so I think that's one thing. So growing up, there was a lot of talk about dentistry, but also I grew up in the same home as the practice.
Okay.
So front half of the house is the office, back
Mhm.
half is lunchtime. So
Yeah. Well, that makes sense. That makes sense. What's the difference between a dentist and a hygienist? Because some people don't understand the difference.
yeah. So a dentist like range of responsibilities goes from like soft tissue exams to administering Novocaine, fillings, restorative in terms of like crowns and bridges, replacing teeth, where hygiene is primarily focused on removing plaque,
Mm.
tartar. Sorry, I'm using dental words here. Cleaning the surfaces of teeth.
Okay. Now, how hard is it to become a dentist? Because you received your doctor of medicine in dentistry. Was that hard? Obviously, you grew up around all of that, but was it hard for you going on your own?
In terms of going to school
Yeah,
or
going to school and going through. Yeah,
school is hard.
yeah,
But
yeah.
I also think anyone feels like school is hard.
Hmm.
So yeah, it was definitely uh, grit is the word I would use, and I think everyone needs grit. But
Great.
I also think that applies to any sort of um, education from
Right.
your high school diploma, your bachelor's. Like it, you really need to stick it in there. I think.
Yeah, yeah.
Um,
And how many years is that? Is it 4 years or is it longer than that?
Correct. It's four.
Okay, 4 years.
It's
Okay.
four. Yeah.
So talk to us, and I've learned the hard way the importance of going every 6 months or twice a year to your dentist.
Well, first of all, before I answer your question, tell me, if you don't mind, what does that mean learning the hard way? Would you share with
Well,
me your
growing up, I would go, every 6 months, and then when I went to college and then beyond, I'm embarrassed to say how many times I had gone. And then I started, because I felt like I'm brushing regularly, I'm flossing regularly. And then I went to the dentist, because I started having bleedy gums. I went to the
Mhm.
dentist and I went through the most painful experience where they numb one side of my mouth, and then they typically really have to dig for the plaque underneath your gums for just years of buildup. So they numb one side, and then I came back the next week, they numb the second side, and even though they numb it, you still feel that pressure. And I vowed to myself I would never miss another appointment.
Okay, that's a great, yeah. And do you
Mhm.
know how, Stephen, I want you to know you are not alone. That
Yeah.
is extremely common.
Mhm.
And I think it's hard because even brushing your teeth, like some of that stuff,
Yeah.
just you need a little bit of help. That toothbrush can't do it all by itself.
Hmm. And you think that because you're brushing your flossing regularly, it just what they explained to me is sometimes it just doesn't get all the plaque. And
Mhm.
then, I had inflamed gums,
Mhm.
at the time. And so that's what was causing the bleeding. And
Mhm.
so yeah, I don't miss an appointment now. The most I missed one appointment during when the beginning of the pandemic because they were closed, but I
Yeah.
finally said no, no, no. So what do you tell people when they if they're not in that regular routine of going, every 6 months or twice a year? Like how do you encourage them?
Well, one of the things I try to say is that it makes our time together a little bit easier.
Yeah.
Because I think sometimes cleanings are uncomfortable.
Hmm.
I mean, I'm not gonna lie and say they're great all the time.
Right. Exactly.
So I think part of coming on a more consistent basis does make them more comfortable.
Hmm.
I also think it just being in the office a little more makes makes that unknown
Yeah. The
less.
experience. Yeah.
Yeah.
That's true. That's true. And so one thing I also, while I was restoring my teeth and my dental health, I I haven't wanted to get braces for years. I used to have like a gap right here, a big gap, and kind of some chipped teeth. They weren't horrible, but um, and then I end up getting Invisaligns, and which I thought would be crazy expensive, but it really wasn't. And that was it was a great experience for me, finally getting some straight teeth,
Mhm. They look
Um,
great. Yeah.
thank you. Thank you. Um, Missing those appointments also can overlook certain other tests that need to be done, like specialized tests. Can you talk about that?
Yeah. So coming routinely for like I'll just use like a baseline like 6 months for a cleaning and checkup.
Hmm.
Um, I think a big thing of what we do is we're screening for oral cancer.
Yeah.
I think that's one of the biggest benefits or in terms of overall health of coming every
Hmm.
6 months. Just because, I mean, what other physician do you see every 6 months
Exactly.
to take a look and check for cancer, especially because it is so common.
Mm.
So take a look at your tongue, cheek, roof of the mouth, floor of the mouth, um, and even just in 6 months when things change, it's nice to document those changes, size, shape, color. And then, you can have a discussion, let's look at the photo. It doesn't look the same.
Hmm.
Maybe let's go get this looked at, or even has your medication changed? Oh,
Yeah.
I haven't been taking it. So I think it's just a nice check-in because things do change every 6 months. So
Exactly. And talk about how important our oral hygiene speaks to our overall health. Kind of what you're touching on, because I know anytime I go to a physical, they first thing they say is, "When was the last time you went to the dentist?" So how does that correlate?
yeah. Well, I think a big thing is that the mouth may seem like a separate entity,
Hmm.
but it's really the start of the digestive tract. Like it's a gateway, really.
Yeah.
Um, so I think a lot of systemic conditions do have oral manifestations.
Yeah.
Um, so whether that's ulcerations or sores or
Hmm.
different colors, like so a lot of those can be detected from the mouth.
Mm.
Um, and uh, I'm sorry, there's one other thing I wanted to add there. Nope, it will come back to me.
You'll come back. But no, I know it's important, and people you don't always think about your overall health as relates to your oral hygiene. So let's talk about your practice. So
Okay.
what can we expect the first time being a patient there, visiting, and what kind of care can we receive?
Yeah. So when you walk in, you're greeted by Tiffany at the front desk, and then you'll see any one of us really, depending on kind of what you want to accomplish.
Hmm.
And I think that's a big thing of what we um, try to do is really understand where you're coming from, your dental background, your dental history, um, and then how you want to move forward
Hmm.
and what your goals are and how we can help you achieve them.
What are some of the goals that you see that your patients that they want to achieve?
Yeah, so some of them want a healthy smile.
Yeah.
And we say, well, what does that mean to you? And for some patients, it's having all of their teeth when they're 50 because their parent didn't have their
Yeah.
teeth when they were 50.
Hmm.
It can mean a brighter smile. It can mean I don't want my gums to bleed when I'm brushing.
Right. Yeah.
Um, it can mean, do you see this little chip here? I
Mhm.
I don't like this. Or do you
Yeah.
see this space between my two front teeth? I don't like
Hmm.
that.
Hmm.
So I think it looks different to everybody, but it's just,
Yeah.
and I think also part of it is asking the right questions to get the answers that you want, and also to be on the same, we're on the same team.
Hmm. Exactly. And one thing, if I didn't start going back to the dentist regularly years ago, I would have never known that my teeth would have been, I would get them straight and they shaved them. So they would all be, it just a lot of work that went into that I wouldn't even had thought about, or thought I could achieve. But as I was going off, then they would ask me, well, we can do this. Do you want to get this done? Um, Now, tell us about laughing gas. I've had laughing gas one time, but it was when I was in high school. I was having oral surgery, and my wisdom teeth pulled. And I tell you, I don't remember anything. I remember when it was over. I asked my mom, did they do it yet? Tell us about that. And are
Yeah.
there some risks? Because I noticed that some people when they get oral surgery now, they're not given laughing gas. So tell us about that, all that.
Yeah, so laughing gas is, the medical term, I guess, is nitrous oxide.
Mhm.
And oh, I feel like if Chike is listening here, he's heard me say this so many times. So we're big proponents of nitrous,
Okay.
or laughing gas. And what it is it's a little nose piece, that sits on your nose and kind of runs the gas through there.
Okay.
And the great thing about it is that you're just like you walked in. You have your procedure, use the nitrous, and then at the end, we get rid of that, flush you with oxygen, so you're the same way as when you came in. And the way I like to describe it is because everybody feels it a little bit differently.
Yeah.
I like to use the word desensitize.
Hmm. Hmm.
So so some people feel like they've had a glass of wine. Some people feel like they're wearing a weighted blanket.
Right.
Other people feel tingly in their arms and legs. Um, and I know when I use it, it just kind of, my shoulders that are under my ears, it just kind of,
Exactly. Relaxed. Uh-huh.
yeah.
Yeah.
And so I can't speak to all oral surgeons or for wisdom teeth. I know some surgeons like to use some general anesthesia. So
Hmm.
you're really sleeping. The nitrous doesn't really do that.
Okay.
Or even some IV sedation. So they have some different options. But we like to use it for anything really in
Mhm.
our practice, cleanings. Yeah.
Wow. Wow. Yeah, some powerful stuff for sure.
Yeah. Yeah.
Now,
I just I
I'm
like to
sorry.
tell patients, like, we don't have to white knuckle through this.
Hmm.
So,
Yeah. What do you feel about teeth whitening? And what are some of the best practices for that? A lot of us we get these dental strips and all that. What would you consider to be some of the best practices?
I think there's a couple of misconceptions about whitening.
Mhm.
Um, just because there is a percentage of the population that doesn't whiten well.
Right.
Um, it just they don't. So I think it's always a little bit tricky.
Hmm.
And also whitening, you like brighten the teeth that you have. You Not everybody gets like these toilet bowl white teeth.
Hmm.
So I think sometimes the meeting expectations and meeting expectations can be tricky sometimes. But honestly, I think one of the best things for brightening teeth is getting your teeth cleaned.
Yeah. Yeah.
Yeah.
Yeah.
But if you are somebody that does want to whiten or talk to your dentist about whitening, I think it's a great conversation to have. And am I a good candidate for whitening? And
Mm.
then I also think, I mean, you can always do the over the counter, not a problem. But I think with in the dental office, it's a little more controlled.
Yeah. Yeah.
Um, so I think your gums are more comfortable when it's done in the office. Um, I also think the product is usually a little higher quality.
Mm.
And then also I think one of the biggest things is sensitivity.
Exactly. Yeah. Yeah.
So I know we have some sensitivity protocol to diminish some of that. Um, so yeah, those
Mhm.
are a couple of thoughts I have.
Okay. Well, appreciate that. And I know we talked about, coming to the dentist regularly. Uh, would you say there's a high percentage of people who only come when something's wrong?
Oh yeah. Oh yeah.
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 Yeah. And what
There
would
is.
you, yeah.
But I think that's life, right? I
Mhm.
think most people only go to some people only go to the doctor when something is wrong.
Yeah.
Some people go to the dermatologist when they have a pimple. Like
Mhm.
I think that's yeah.
Yeah. And what would you say to those people? How do we encourage people to go regularly, to go so they're not having these issues? Because going regularly prevents a lot of times some of the issues that happen down the road, correct?
Correct. Correct.
Yeah.
And I think that's a great question. And if anybody else knows an answer for that, I would love to hear it. But I think when people do um, when people come, they have an issue, and we fix the issue. I like to say, "Are you interested in preventing this from happening again?"
Mhm.
And then if they say no, all right,
Yeah.
okay, well, I'll be here next time.
Right.
And if they say yes, they're asking for a solution. So then I can offer one. Um, so that's usually how my transition of, do you
Right.
want to prevent this? Great, we can do this together.
Mhm.
But if they're okay just coming, I think also if I get it, it's hard. I want to be there for them. I'm not attached to if they want to be preventative or not.
Right. 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 So I've become a master flosser uh, over the years, and I didn't realize I was doing it wrong. Uh, I didn't realize,
Okay, you got to tell me more.
because they would say, "Do you floss?" I'm like, "Yeah, I floss twice a day," and they were like, "Are you sure?" Yes. And so they actually gave me a tutorial on how to floss correctly, make sure I'm, you know, and so once I listened and start doing it, when
Mhm.
I go to my appointments, like, oh, you're doing a great job. There's no plaque buildup underneath your teeth and things like that. Um, and I think that just speaks to a good dentist, taking the time to really show you, because a lot of people think we know we're flossing, and
Mhm.
then showing you effective ways to floss.
Well,
Um,
hold on. You gotta show me this initial way of how you floss.
I think before I would just kind of go in between each tooth, you know what I mean?
Yeah.
But instead of dragging it out and kind of going from gum to gum,
Yeah.
making sure you get all the particle and also use a water pick now too.
Oh, we do love a water pick.
Yeah.
Yeah.
So I floss and do a water pick. So I just don't want to go through that torture. It's been years, but I remember it. I
Yeah.
remember it, and I don't want to go
Yeah.
through that again. Now talk about diversity in the dentistry field. Um, is it getting better? Is it an issue? What are your thoughts?
Yeah. So, um, I think I think it's a work in progress, just
Okay.
like everywhere else.
Hmm.
but I do think something that's important to me is making the community more diverse. And I
Yeah,
think dentists in general, at least the ones that I've experienced, are very welcoming. They're willing to share their knowledge, and there's a lot of room for everybody.
yeah,
Um, so, and I think it starts. I think a big, well, looking at how I got into the dental field, a big part is exposure,
exactly. Yeah.
and just knowing it's there.
Mhm. Yeah.
So, yeah. So what I guess if you don't mind, I'll do a little plug for this group based in Camden called Rising Leaders Global.
Okay.
I don't know if you've heard of them before,
Mm-mm.
but so what we do is we work with youth in Camden and try to expose them to different career opportunities.
Mm.
And so we had a little like dental day last year.
Okay.
Um, where the kids come and then um, we do different activities that we do every day at the
Okay.
dental office. So it was fun for them to see like, oh, I'm good at this. I could do this, or like,
Mhm.
and then also I think it's cool to see like, if school isn't for you, you don't have to go to dental school for 4 years. You can do a program for 6 months and then become part of a practice and
Okay.
really contribute.
Hmm.
Um, so that's something that we've been working on, is just trying to be a place for the community to expose um, the youth to.
Exactly. Yeah, I used to work with the youth years ago, and that exposure piece, it just shows you things. Oh, I could be a dentist, or I could,
Mhm.
So yeah, that's awesome. Is there
Yeah.
anything else you really want us to know about this field? I think it's important because, again, people don't always, attribute their health to their oral health, and who does not want to have nice looking teeth? So, anything else you want us to know when it comes to
Um,
our oral health?
well, actually, so I did think about what
Okay.
missed me earlier.
Uh-huh.
I think something that's really cool to think about is that your mouth is really the only place you can control inflammation
Mm,
by doing something. I
mm,
think arthritis in the joints, like, you really can't control the
yeah.
inflammation there, but your gum tissue, by coming to the dentist, water pick, floss, like that's somewhere that you can make a difference.
Hmm. It was interesting. After I started getting my mouth together, I had gone to go visit my sister, and she said, we were talking. Did you do something to your teeth? And I had forgotten because it'd been a while, but it was just
Mhm.
like, yeah, it's always a compliment when you get something about your teeth, or
It is, yeah. And it's awesome she noticed too.
right, exactly,
Yeah.
exactly.
So then I have a question for you. I get a lot of dental talk because of what I do, but do you and your friends talk about your dental care or dentistry at all?
Initially, when I started making the changes, and I started getting, when I was going through the Invisaligns, actually had some friends who they got Invisaligns as well.
Mhm.
And then, but now it's been a while since my teeth, they've been kind of consistent. And so, but yeah, initially, yeah, people would ask, they would
Mhm.
ask because, it was even so, I didn't realize how much it affected me prior, because I noticed I wouldn't smile with my teeth, smile with my mouth open. I'd always cover my teeth because I knew I had that gap there. And now to cheese. But it does give you a confidence boost, when you have a nice smile or your nice teeth, Um, so
I
yeah.
I agree. I even had a patient today that we were doing some work with his front teeth, and he said, I'm not a big I'm not like, I don't really show my front teeth a lot when I talk or when I smile or anything like that. And he may not, but from when I first met him to all the
Uh-huh.
work we've done, that lip has slowly
I
creeped
bet
up.
it
So
is. I
yeah.
bet it is. I had a friend who was missing a tooth here,
Mhm.
in the corner, and when he would laugh, he'd always laugh like this, covering up his mouth. And he got it fixed, and now that hand is gone. That hand is gone.
And I think also it's cool to see just when I don't always think you realize how much confidence you
Mhm.
gain from your smile.
Absolutely, absolutely, absolutely. I know it definitely helped me. Where's the best way people can learn more about your practice or keep in touch with what you have going on? Is there social media, website? I saw your website for the practice, but what's the best way?
Yeah, I think the website is great. And then we do have a Facebook page, which I know is I think we update that kind of weekly with different thoughts, different
Okay.
articles for um, heart health, gum tissue, stuff like that.
Yeah.
So yeah,
Listen, I want to thank you so much for taking time out of your schedule and joining us. There was a question I wanted to ask because I was doing research for this interview. They were saying how a lot of one of the benefits of being a dentist is you kind of can make your own schedule. Do you find it to be true?
I do. Yeah. And I think that's one of the things that I really enjoy about
Yeah.
dentistry. Um, and you know, you can set your own hours.
Mm-hmm.
Um, and then you can also make the day what you want it to be. The
Mm-hmm.
procedures you like, you can do a lot of. The procedures you don't like, you can refer to your friend down the street.
Right.
Um, and yeah, so I really think you can make it what you want.
Mhm.
And I think it has a lot to offer for anybody. A lot of science, a lot of art, a lot of patient interaction.
Yeah.
Um, so
Becomes a community too, I would say, because I see a lot of people going there, and I've been going there for years, when they go
yeah,
to this. Well, listen, I want to thank you again for joining us tonight. There will be a link in the bio of this video where you can learn more. And thanks again. I think this is a very important conversation. I appreciate your time.
thank you, Stephen. I appreciate your time too.
Thank you. And we'll be right back after this.